Right now, deep inside your body, your liver is performing over 500 different chemical reactions every single second of your life. This remarkable organ works tirelessly in silence, filtering toxins, producing proteins, storing energy, regulating hormones without you ever feeling a thing. But what happens when fat begins to accumulate in this vital organ, slowly transforming healthy tissue into something your body no longer recognizes? The truth is, 1 in 3 adults is walking around with a liver that's quietly drowning in fat, and most have no idea. No pain warns them. No obvious symptoms signal danger. No dramatic moment marks the beginning of this silent transformation happening deep inside. What if your liver could speak to you right now and tell you what it desperately needs you to understand? This is the hidden story of fatty liver disease, a condition that's become one of the most common yet misunderstood threats to human health. Your liver weighs about 3 pounds and sits tucked beneath your ribs on the right side, working every moment to keep you alive. Think of it as your body's master chemist, processing everything you eat and drink into substances your cells can actually use for energy. It breaks down medications, neutralizes alcohol, produces bile to digest fats, stores vitamins, and manufactures proteins that help your blood clot when you're injured. When you eat a meal, your liver decides what to do with every single nutrient that arrives through your bloodstream from your digestive system. Some gets converted to energy immediately, some gets stored for later, and some gets packaged and sent to other organs that need it right now. But in fatty liver disease, something goes wrong with this intricate processing system, and fat begins to accumulate where it doesn't belong at all. Imagine your liver cells slowly filling with tiny droplets of fat, like water balloons expanding inside a crowded room with nowhere to go. At first, the fat just sits there, taking up space, making the liver slightly larger, slightly heavier, but causing no immediate harm or pain. This is called simple fatty liver, and for many people, it stays this way for years without progressing to anything more serious or dangerous. But in some people, the accumulated fat triggers something more sinister, activating the immune system and setting off a cascade of inflammation throughout the liver. When inflammation arrives, it brings with it an army of immune cells that begin attacking the liver tissue, trying to protect you, but actually causing damage. This is when fatty liver disease transforms into something called steatohepatitis, where inflammation and liver damage occur together in a destructive partnership that accelerates over time. The liver tries to heal itself by forming scar tissue, but if the inflammation continues, the scarring spreads like cracks in a foundation, weakening the entire structure. Over years or decades, this scarring can progress to cirrhosis, where so much scar tissue has formed that the liver can no longer perform its life-sustaining functions. Here's what makes this disease so dangerous. Most people feel absolutely nothing until the damage is already severe and potentially irreversible in many cases. Have you, or someone you love, been told you have fatty liver disease and felt confused about what it really means for your future? The question that drives this story forward is simple but profound. Why does fat accumulate in the liver, and what can we do to stop it? To understand this, we need to look at what happens inside your body when you eat more calories than you can burn in a single day. Your body is remarkably efficient at storing excess energy, a survival mechanism that helped our ancestors survive famines and periods of food scarcity throughout human evolution. When you consume more carbohydrates or sugars than your body needs immediately, your liver converts them into fat through a process called de novo lipogenesis. This newly created fat can be stored in fat cells throughout your body, but when those storage spaces fill up, the fat has nowhere to go. So it begins to accumulate in places it shouldn't, including your liver, your muscles, and even around your heart and other vital organs deep inside. Insulin resistance plays a crucial role in this process, creating a vicious cycle that makes the problem progressively worse over time without intervention. When your cells become resistant to insulin, they can't absorb glucose from your bloodstream efficiently, so your pancreas produces even more insulin to compensate for this. High insulin levels signal your liver to make more fat while simultaneously making it harder for your liver to break down the fat that's already there. Meanwhile, fat cells throughout your body start releasing their stored fat back into your bloodstream, and much of it ends up in your liver. Scientists have discovered that certain genetic variations make some people more susceptible to developing fatty liver disease, even with modest weight gain or dietary changes. But genetics is only part of the story, because lifestyle factors play an enormous role in whether this condition develops and how quickly it progresses. The modern diet, rich in processed foods, added sugars, and refined carbohydrates, creates the perfect storm for fat accumulation in the liver over years of exposure. Fructose, a type of sugar found in high amounts in sweetened beverages and processed foods, is particularly problematic for liver health and fat accumulation. Unlike glucose, which can be used by cells throughout your body, fructose is processed almost entirely by your liver, overwhelming it with work it wasn't designed to handle. When your liver is constantly flooded with fructose, it converts most of it directly into fat, contributing to the accumulation that characterizes this disease so clearly. But here's what many people don't realize. You don't have to be overweight to develop fatty liver disease, a misconception that prevents many from seeking help. About 1 in 5 people with fatty liver disease have a normal body weight, a condition called lean fatty liver that's often overlooked by doctors and patients alike. In these cases, the fat distribution in the body, genetic factors, and metabolic health matter more than the number on the scale or traditional weight measurements. Research shows that visceral fat, the deep abdominal fat that surrounds your organs, is far more dangerous than subcutaneous fat just beneath your skin's surface. This visceral fat is metabolically active, releasing inflammatory chemicals and hormones that directly contribute to insulin resistance and liver fat accumulation throughout the body. What if the fatigue you've been experiencing, the brain fog that won't lift, or the unexplained weight gain are all connected to your liver's struggle? Many people with fatty liver disease report feeling tired all the time, experiencing difficulty concentrating, or noticing a vague discomfort in their upper right abdomen occasionally. Some develop dark patches of skin on their neck or underarms, a sign of insulin resistance that often accompanies fatty liver disease in many patients. But because these symptoms are so common and nonspecific, they're often dismissed by both patients and doctors as just part of getting older or being stressed. The truth is, your liver is trying to tell you something important, sending signals through your body that something needs to change before it's too late. Here's what science shows us about the progression of this disease. It doesn't happen overnight, and at every stage, there's an opportunity to reverse the damage. Simple fatty liver can often be completely reversed through lifestyle changes, with the liver returning to normal health within months to a year of consistent effort. Even when inflammation has begun and some scarring has occurred, significant improvement is possible if the underlying causes are addressed with dedication and proper guidance. The liver has an extraordinary capacity to regenerate and heal itself, a superpower among organs that gives us tremendous hope for recovery and restoration of health. Studies have shown that losing just 7 to 10% of your body weight can dramatically reduce liver fat and inflammation in people with this condition. But weight loss alone isn't the complete answer, because the quality of your diet and the types of foods you eat matter just as much. A diet rich in whole foods, vegetables, fruits, lean proteins, and healthy fats supports liver health by reducing inflammation and improving insulin sensitivity throughout the body. The Mediterranean diet, in particular, has been shown in multiple studies to reduce liver fat and improve liver enzyme levels in people with fatty liver disease. Exercise plays a crucial role too, not just by helping with weight loss, but by directly improving how your body processes glucose and fat at the cellular level. When you exercise, your muscles become more sensitive to insulin, pulling glucose from your bloodstream and reducing the burden on your liver to process excess sugar. Aerobic exercise like walking, swimming, or cycling, combined with resistance training, appears to be the most effective approach for reducing liver fat and improving overall metabolic health. What's remarkable is that exercise can reduce liver fat even without significant weight loss, suggesting it has direct protective effects on liver cells themselves. Sleep quality matters too, because poor sleep disrupts the hormones that regulate hunger, metabolism, and fat storage throughout your entire body and liver. When you're sleep deprived, your body produces more cortisol, a stress hormone that promotes fat storage in the liver and makes insulin resistance worse over time. Can you remember a time when you made a small change in your daily routine that ended up transforming your health in ways you never expected? The journey to reversing fatty liver disease isn't about perfection or dramatic overnight transformations, but about consistent, sustainable changes that add up over months and years. One woman discovered she had fatty liver disease during a routine checkup when her doctor noticed elevated liver enzymes in her blood work results. She felt fine, no symptoms at all, and couldn't understand how her liver could be in trouble when she felt so normal in her daily life. But an ultrasound confirmed it. Her liver was enlarged and filled with fat, the result of years of stress eating, sedentary work, and too many sugary snacks. She started with one simple change, replacing her daily soda with water, a small step that felt manageable when everything else felt overwhelming and impossible to tackle. Then she added a 20-minute walk after dinner, not because she loved exercise, but because it gave her time to think and breathe outside. Within 3 months, she had more energy, her clothes fit better, and her follow-up blood work showed her liver enzymes dropping back toward normal ranges. 6 months later, another ultrasound revealed something remarkable. The fat in her liver had decreased significantly, and the inflammation markers had nearly disappeared from her blood work. Her doctor told her something that changed her perspective forever. She had given her liver the gift of time and the right conditions to heal itself. This is the power of understanding what's happening inside your body and taking action before the damage becomes permanent and irreversible with time. But what about the people who already have advanced scarring or cirrhosis? When the liver has been damaged for years without intervention or awareness? Even in these cases, stopping the progression of the disease is crucial, because cirrhosis can lead to liver failure, liver cancer, and the need for transplantation eventually. Emerging research is exploring medications that might help reduce liver inflammation and scarring, offering hope for those with more advanced disease who need additional support. But the foundation of treatment remains the same, addressing the root causes through diet, exercise, weight management, and controlling conditions like diabetes and high cholesterol. If you're worried about your liver health, The first step is talking to your doctor about screening tests that can assess your liver function and fat levels. Blood tests can measure liver enzymes and other markers of liver health, while imaging tests like ultrasound or specialized scans can detect fat accumulation in the liver. Early detection matters enormously because it's much easier to reverse simple fatty liver than to treat advanced disease with significant scarring and inflammation throughout the organ. What's one small change you could make today that your future self would thank you for? A choice that honors your body's remarkable ability to heal. Start by looking at your diet and identifying the biggest sources of added sugars and refined carbohydrates that might be overwhelming your liver's processing capacity. Swap sugary drinks for water or unsweetened tea. Replace white bread with whole grains and add more vegetables to every meal you eat throughout your day. Move your body in ways that bring you joy, whether that's dancing, gardening, swimming, or simply walking through your neighborhood while listening to music you love. Prioritize sleep by creating a consistent bedtime routine, dimming lights in the evening, and giving your body the rest it needs to regulate metabolism and heal properly. Manage stress through practices like meditation, deep breathing, time in nature, or connecting with people who support and uplift you in your daily life. If you drink alcohol, consider reducing your intake or eliminating it entirely, because alcohol is directly toxic to liver cells and accelerates fat accumulation and inflammation. Remember that your liver is remarkably resilient, capable of regenerating and healing itself when given the right conditions and time to do its extraordinary work. Every healthy choice you make, every meal that nourishes rather than overwhelms, every movement that strengthens your body is a gift to your liver and your future. The hidden threat inside you doesn't have to define your story, because you have the power to write a different ending through knowledge and consistent action. Your liver has been working tirelessly for you since before you were born, filtering, processing, protecting, never asking for recognition or rest from its vital duties. Now it's asking for your help, not through pain or dramatic symptoms, but through the quiet accumulation of fat that science can now detect and reverse. The journey to liver health is also a journey to overall health, because everything that helps your liver helps your heart, your brain, your metabolism, and your longevity. You don't have to do everything at once or be perfect in your choices, because sustainable change happens through small, consistent steps taken day after day. Talk to your healthcare provider about your liver health, especially if you have risk factors like obesity, diabetes, high cholesterol, or a family history of liver disease. Get screened, get informed, and get started on the path to protecting this vital organ that works so hard to protect you every single moment of your life. The power to reverse fatty liver disease lies not in a pill or a quick fix, but in your daily choices and your commitment to your own health. Your liver is waiting, ready to heal, ready to regenerate, ready to return to its full strength if you give it what it needs to thrive. And that gift you give your liver today becomes the gift of a longer, healthier, more vibrant life that you give to yourself and everyone who loves you.